If you have hyperthyroidism and also have thyroid nodules, then you might wonder if a natural hyperthyroid treatment protocol can shrink these. Natural thyroid treatment methods can help many people with thyroid nodules, although I must admit that there is no way of telling in advance as to whether such a protocol will shrink any you may have. Plus, if you have any of the following conditions, it might be best to receive immediate medical intervention rather than wait for the natural hyperthyroid treatment methods to kick in. A malignancy. This is an obvious situation where medical intervention is needed, as if the thyroid nodule is found out to be cancerous, then a natural hyperthyroid treatment protocol isn't recommended. Of course, if the person has the thyroid nodule surgically removed, which is a likely scenario in this situation, then the person might still want to follow such a protocol to help restore their health and prevent the formation of other nodules, assuming they didn't receive a complete thyroidectomy. But upon being initially diagnosed with a malignant thyroid nodule, you most likely want to follow the advice of your endocrinologist. Now, this doesn't mean that you shouldn't receive a second opinion to confirm the findings of the first endocrinologist, but if both doctors agree that surgery is the best option, then it's probably a good idea to follow their advice. If the thyroid nodule is causing an obstruction which is causing difficulty breathing and or swallowing, then this is another good reason to receive immediate medical intervention. While a natural hyperthyroid treatment protocol might shrink the thyroid nodule and help with the obstruction, the problem is that it will take time for these treatment methods to work. So surgery is usually required if someone has difficulty swallowing or breathing due to a thyroid nodule. If someone has hyperthyroidism and then develops one or more thyroid nodules, then a natural treatment protocol very well might be the best option. On the other hand, if they develop hyperthyroidism due to the thyroid nodule, then some type of medical intervention will probably be required to manage the symptoms. However, this doesn't necessarily mean that the person should receive radioactive iodine therapy or surgery. If the hyperthyroid symptoms are severe but are manageable with medication, then what the patient can choose to do is to take antithyroid drugs and or a beta blocker and at the same time begin a natural hyperthyroid treatment protocol. This will allow the symptoms to be under control and at the same time will give the natural hyperthyroid treatments time to take effect and hopefully shrink the thyroid nodule. If this is unsuccessful, then radioactive iodine or surgery might be necessary, but in my opinion it's at least worth giving natural hyperthyroid treatment methods a try in order to help to preserve the thyroid gland. In addition to the above scenarios that I just mentioned, any other situation which involves severe symptoms caused by the thyroid nodule may need medical intervention. Once again, the reason for this is because it takes time to see a reduction in symptoms when following a natural hyperthyroid treatment protocol. So if someone has severe discomfort or any type of pain caused by one or more thyroid nodules, then they might need to have surgery. In many of the situations I just mentioned, endocrinologists will recommend that the patient have their thyroid gland removed rather than just the thyroid nodule itself. If surgery is necessary, the ideal situation would be to only have the thyroid nodule removed, and if this is impossible, to have a partial thyroidectomy. However, many doctors seem to recommend a complete thyroidectomy under these situations. So if you are ever advised to have your thyroid gland completely removed, I would strongly advise you to seek a second opinion. The reason for this is because while any surgery has its risks, surgery of the thyroid gland can be even more risky. While it might not lead to many fatalities, it is not uncommon for someone to have their parathyroid glands damaged or other surrounding structures damaged when receiving thyroid surgery. In addition, when someone has their thyroid gland completely removed, they will need to take either synthetic or natural thyroid hormone for the rest of their life. What frustrates me is that when a patient has one or more benign thyroid nodules, yet doesn't have any symptoms, and yet surgery is still recommended. I don't know why an endocrinologist would recommend surgery under such circumstances. Unless if the thyroid nodule is malignant or is causing severe problems, then why risk having surgery? This is especially true when a doctor recommends surgery of the thyroid gland for asymptomatic nodules. Fortunately, this isn't too common, but it does happen. As for natural hyperthyroid treatment methods, the goal of these treatment methods is to get to the underlying cause of the hyperthyroid condition. What's important to understand is that in most cases of hyperthyroidism and Graves' disease, the malfunctioning thyroid gland isn't the actual cause of the disorder. As a result, thyroid surgery might help with the symptoms, but won't do anything for the actual cause of the disorder. This means that the person might remain susceptible to developing other conditions in the future. In summary, if you have hyperthyroidism and one or more thyroid nodules, natural hyperthyroid treatment methods might be able to help you. However, if you have a situation described before where immediate medical intervention is required, then it's best to consult with an endocrinologist or another type of medical doctor, as you need to realize that it will take time for natural thyroid treatment methods to work. To receive more natural thyroid health tips, please visit naturalendocrinesolutions.com, where you can get a free guide entitled The 6 Steps on How Natural Thyroid Treatments Can Restore Your Health. This guide contains 100% pure content and is not a sales pitch for any product or service. Thanks for watching this presentation.